Let's go about health issues. The most important issue is fistula. As I suffered for over 4 years, and how I got rid of it, I have no problem for 4 years without operation, without allopathy. Can you imagine? I am probably only person out of 8 billion people, that is you say 800 people, that is 8 billion people. Probably I have solved this problem because of something I talk about later. First, let's go about fistula in detail. Fistula, that is anal fistula. If you have pus here, that's fistula, right? Anywhere is possible. But what we say is, talk about is anal fistula. In the anal passage, you have the problem. How? There are two ways you can have fistula. Number one, when you have food, you may have contaminated food. There may be bacteria that have attacked your glands. You have 19 pairs of glands, and there one pair of glands may be rotten, maybe infected by bacteria, and there you develop pus. So pus is something that must go out of your body. You can't control it. It must go out of your body. As it is very near to the anus, anal cavity, what happens is that it makes an abscess, right? How? Why? Because if you have an abscess and if the mouth is ruptured, then the pus will get out of your body. That's why near the passage of anal cavity, you develop some pus because of bacterial infection. And when you have it, then there will be an abscess just to get your pus out of your body. And can you imagine, your anal cavity has been walled by some skin, and you have also walled by skin. So outer skin is very hard, the buttock skin is very hard. That's why the abscess goes towards the anal cavity, and there it gets lump, it gets an abscess, and then at one point the abscess ruptures, breaks, and then the pus gets out. When the pus gets out, you have pain, especially after the fecal pus, that is the stool pus, bowel movement, and that pus and the mouth of the abscess get contaminated, and it creates a lot of pain, burning sensation, horrible, painful. It usually doesn't kill anybody. It doesn't usually develop into cancer, but it's been lifelong disease, very difficult to beat. It's really tough because the antibiotic can't work inside that kind of pus, right? The abscess. So what's very important is that when you have lump, when you have some pain while you are passing stool, then go to a doctor. If you don't have money, you must go to the doctor. And the doctor will usually finger inside your anus, and then the doctor will understand that there is an abscess, either ruptured or not ruptured. If it is not ruptured, you have antibiotic. It should not be taken for a few days. Take it for 10 days or 14 days so that it is absolutely gone. If you have excess amount of antibiotic, it's very bad for your health. You have gut bacteria, 40 trillion gut bacteria. That's helpful for our body. So when you want to kill some bad bacteria, you are also killing a lot of good bacteria. But still, as anal fistula is very, very difficult to go, it's really painful, horrible. It's something that's really horrible. You can't do anything, right? You can't do anything. Every day we'll have bowel movement, and after bowel movement, maybe half an hour, maybe an hour, maybe 2 hours later, maybe 3 hours later. Even it has happened to me that 3 hours from the stool movement, and I thought that, oh, my fistula is gone because it's not paining. But it's not true. After 3 hours, the pain starts and it's horrible burning sensation. What you have to do is you have sitz bath. That means you get warm water and you sit there, and then you stay for sometimes maybe 15 minutes, maybe 20 minutes, and then the pain usually goes away. You can have Epsom salt, you can have normal salt, but for girls it's really difficult because vaginal problem, there may be sensation because salt is, not so easy to, it gets into and it irritates you, right? So even when you don't have Epsom salt, even when you don't use normal salt, it doesn't much matter. It doesn't much make any difference. So the thing is that this is how you develop fistula. In the initial period, you have an abscess, but when it ruptures and it goes for kind of 21 days, if your antibiotics have not killed all those bacteria, what happens? It gets channels, right? It gets into different parts around your anus. Very, very difficult situation. So if you have homeopathic medicine, if you have herbal medicine, you can almost get it clear, but not clear absolutely. Again, when you have constipation, when you have bad food, when you have a lot of sugar, carbohydrate, starch, what happens? Easily the bacteria gets powerful, bacteria feeds on sugar. So the less sugar you have, the less diabetic problem you have, the better it is. If you don't have food, it's full of starch or carbohydrate, then bacteria will die of starvation, will have no food to eat. So that can help you. And when you have a lot of vegetables, food without sugar, carbohydrate, starch, what will happen? You have a lot of fiber. Because of fiber, you have stool that is full of with a lot of water, and that fiber will be eaten by your gut bacteria. That is 1 trillion bacteria you have, that can be strong and can fight with the bacteria that has attacked you, right? And the third thing is that when you do not have sugar, no problem with diabetes. If you do not have starchy food or carbohydrate food, then what will happen? The bacteria will starve to death, will not eat anything. That is how you can get rid of it. So the first thing, if you have any pain, if anything uncomfortable in your anus while you're passing stool or any pain or whatever, you can even finger inside your anus and can find out that there's some lump. Then you go to doctor and get it confirmed and get antibiotic, and don't go for 5 days, 7 days, go for 10 days, for 14 days. If you have recovered in the beginning, then that's fine. And if you can't, after 21 days, the anal fistula gets longer, right? It goes to different places, channels, right? Long channels, and it's very difficult to have your operation done. The longer your fistula, the worse when you have operation. The operation is something like the rotten mango, right? The mango is rotten. What you have to do is to cut out the rotten part. So the longer, the more, right? And a mango you cut and cut and cut. That's really terrible. So the same thing happens to fistula. The operation doesn't get successful usually. The longer, the later you have it operated, the more chances that you have to regain it. You will get it back. That's terrible. So what's better is you have a special doctor, A.K. Fazlul Haq. He operates in Dhaka. Even German ambassador in Bangladesh has had his operation done by A.K. Fazlul Haq, and he charges a lot. At the same time, he cuts a lot of flesh so that the fistula doesn't recur, doesn't get back, right? But it's painful. You have to have gauze inside, and you have to remove the gauze, and there will be cleaning, and it's really very tough, very difficult. So you can have it operated in the beginning, you can do it, but if you follow my advice, then you don't need to have operation. But if you don't follow my advice, then you have to have it operated as early as possible. There's another one, piles. Piles is not usually painful, but piles usually bleeds while you are passing a stool, then there may be bleeding, right? There will be problem like blood is passing out of your anus, but it's usually not painful, and piles is not that much difficult. If you have money, then you go to a doctor. The doctor will operate in two ways. So one, you see, right, it goes in, and then it squeezes and it cuts. So the piles is a kind of alveolar. You have alveolar, two tongues in our mouth, small tongue in the back, that is alveolar. So the same thing happens in your anal cavity. There's an extra lump of flesh, that is a kind of alveolar, second tongue, right? So it's painful, not that much, but usually it bleeds. And when you have constipation, when you haven't had good food, then problem arises. So in case of piles, it's not a big deal. You have to spend some money. Just within 30 minutes your operation is done. No pain, nothing. You can usually be quite fine. There's nothing wrong. And if you keep it for long, then you have to take antibiotic medicine and all the problems. And out of these uncontrolled piles, what happens? There's an artificial fistula. Artificial fistula means basically it's not fistula, but because of piles, something wrong more and more, and it damages the skin, and at the end of the anal cavity there's some kind of fistula. It's also fistula, but this is not the original fistula, secondary fistula, like the cancer, primary cancer, in maybe breast cancer primary, and then it attacks liver, that is secondary cancer, right? So piles is not a big deal, but it disturbs you. It doesn't go away, so be very careful. In the beginning, if you have found that you have piles, then go and get it done. So one way, the right trap goes in and it squeezes and cuts it out. Fine, no problem. The other one is, this is more modern, something like this, going and it squeezes and gets it cut, right? That's how the problem is solved. The money is just spent, no health hazard, no hospital staying, nothing, right? Everything is fine. But fistula is very difficult. If you can manage to get it out within 21 days, then you're fine by bacteria, by antibiotics. But if you can't solve the problem, then it gets fistula. It's a long process to heal. It doesn't really heal unless you listen to my advice, how I got rid of it, right? You can have it operated. Operation may be simple in the beginning, but it gets harder later. And when you have old fistula, what happens? You have a very difficult time. Then what should you do? You have homeopathic medicine, you have herbal medicine, then the problem is almost solved, but it doesn't go away 100%, maybe 90%, maybe 80% gone, but it comes back when you have constipation, when you have bad food, things like that, right? So this is one kind of fistula, but second kind of fistula is very unfortunate. It's your fault. So my fistula was not my fault, but it was a problem. I had infection, and then it rotten one of the 19 pairs of glands, and that's how I had it. And my brother gave me medicine, and it was almost gone, but I did not go for many days. I just had 5 days or 7 days antibiotic, and that's how I could not get rid of it. Bacteria, what happens? After 20 minutes, every 20 minutes after, the number of bacteria gets double. If you have 1 million bacteria, then 20 minutes later 2 million, 20 minutes later 4 million, 20 minutes later 8 millions. Like this, it will carry on, it will go on and on. This is something like the Titanic song, my heart does go on and on. It always thinks of you, right? Titanic theme music, background music. So if you listen to my words, if you follow, then you can get rid of it. So as soon as possible, if you have problem in your anus, then go to doctor and he will finger it inside, and if not possible, then he will have a machine and check it, and medicine will be given. If you can't get it out, then you may go for operation. The earlier the better. Or the best thing is that the advice I'm going to go to, right, that may help you get rid of it. Probably I'm the only person on earth who has got rid of fistula out of no medicine, out of no surgery. Surgery is a must, but I say surgery is not a must, but it's easy in the beginning. And if you follow my advice, then you can get rid of it, right? So second kind of fistula, as I told you, you have constipation over and over time when you get a lot of cuts, micro cuts, not visible by your eyes. You have to see them by microscope, right? So these cuts get contaminated and you see there's stool and a lot of bacteria get contaminated, everything problematic. So what happens at one point, you're taking medicine or somehow you got rid of the micro cuts, but by this way, if you get on constipation for long, then the thing is that the cuts get contaminated and that becomes something horrible, that is fistula. So by this way, it's not called fistula, this is called anal fissure. Basically the result is the same. If it is anal fistula, if it is anal fissure, the result is the same. You have pus, you have cuts, you have contamination and all the pain, and especially after the passing of stool. So how did I get rid of fistula? This is most important. What I did is, as I told, 4 years I had been having homeopathic medicine and it's almost gone and then it comes back. Almost gone, then comes back. No problems not solved. Then at the end of 4 years, a doctor, he gave me some herbal medicine and it quickly got the problem solved. But later it came back. So what did I do is, for 100 days I had no starch, no sugar, no carbohydrate, right? Very vital. When you do not have sugar, starch, carbohydrate, then the bacteria can't have food. It gets starved to death without food. And two, if you have free from food, free from carbohydrate, if you have fiber, then the fiber is eaten by that 1 trillion bacteria, and that good kind of bacteria, gut bacteria, feed on the fiber. And number 3, the fiber keeps your stool very much mushy, very much soft, because it holds a lot of water. When food is there, after digestion, the stool is there, then there's a lot of fiber and a lot of water is there. That's how your stool is soft, comfortable, right? So constipation is very bad, and dysentery is also very bad, because dysentery has a very strong force and it cuts your anal cavity, right? The skin inside the anus. So both of them are bad, but constipation is much worse. So you have to be very serious about food so that you don't have constipation. At the same time, what you do is, you don't have any starchy food, carbohydrate food, any sugar, nothing. Then the bacteria that have contaminated your anus will get starved to death. This is how, and medicines don't work. In the beginning, you have to have antibiotic. If you can't solve the problem in the beginning, then no more medical treatment, no more medicines, because medicine can't work. The antibiotics can't work. They cannot go inside the pus, inside the abscess, right? It can't reach there. That's why you have to have no starch, no carbohydrate, nothing, no rice, no grains, no you see, no bread, no rice, you take exercises, you sleep well, and free from sugar or carbohydrate, then the problem will get out of you. So I've been for 4 years having no problem with fistula. I'm sure that it has gone. One doctor I met and I told, can you please help me? I don't know whether am I the only person who got rid of fistula without surgery. And he doesn't care. He said, oh, your fistula has not removed, it has not been cured. So I couldn't say anything. I know for 4 years everything is fine. There were a lot of lumps and hard and so many things, but for long I haven't seen anything wrong about it. So I'm sure that nothing is wrong. And one girl from Sri Lanka, she wanted to get rid of it. When I told that my fistula is gone, she says that no, you have not had fistula. Fistula can never go without surgery. But it's not true. It's not true. It's painful. It's even more painful for girls because vagina and anus are very close together. There is fistula and it can get into the vaginal cavity, then that's even more dangerous. For girls it's very dangerous. Even a man can have a sexual life, family life, even when he has fistula, but a girl can't have. It's very painful. So for a girl it's much more dangerous, and a girl is more prone to get this disease because of childbirth. There are so many issues because of these issues, sexual intercourse, there are problems. So girls get much frequently, many more girls get this problem. But it's good that it's not usually cancerous. It's very difficult to have good day-to-day life. Day-to-day life is always very painful. Every day you will have bowel movement and you will be in pain for 1 hour, 2 hours, 3 hours, even whole day. When I had first homeo medicine, I was told that could aggravate your situation, and that happened for 3 days all the time. And if you pass 2 times the stool, 3 times the stool, then all the day long you will have pain. When your pain is gone, you have stool movement, then it gets back. After your pain has gone, then so I had very little food at that time just to avoid stool. And if it is 1 day later, that's very nice. But if it is for after some days, then the stool may get very hard, then that's a problem. So in a week you may have 3-4 times stool movement, that's fine. And if it is 7 days every day, then no problem. But don't get if you have 2 times stool pass, 3 times, then it's really horrible. So that's it for now. Thanks for watching.